Now, from CBS 4 News, this is Facing South Florida with Jim DeFede.
Good morning, I'm Jim DeFede, and welcome to Facing South Florida. Later in the show, we will talk to Broward Sheriff Gregory Toney about his efforts to hold deputies accountable when excessive force is alleged. But first, with the growing concerns here in the United States about the spread of the coronavirus, I spoke late last week with Congresswoman Donna Shalala. She has a unique insight, having served 8 years as the Health and Human Services Secretary during the Clinton administration. I start by asking, how serious of a threat is the coronavirus?
It's serious. There's no question that the coronavirus is here in the United States and it's going to spread. The CDC has told us it's going to spread, and so we have to be prepared. And of course, our hospitals have experience, both our public hospital, our great public hospital, as well as the community hospitals in Miami have experience in isolation and in treating patients. The big challenge is going to be that we're in flu season, and our emergency rooms and our beds are going to be occupied by flu patients. And that's a good reason to tell people to go get their flu shots right away, because they don't want to end up in the hospital when we need those beds most likely for victims of coronavirus.
How prepared do you believe the federal government is to handle this crisis right now?
Well, let me say that we have first-rate physician scientists leading the efforts at the CDC, at the FDA, in the Public Health Service, at the NIH. They're now being coordinated for the first time by the White House, led by the Vice President, and he's just appointed a deputy, Deborah Birx. Colonel Birx, who holds the rank of ambassador, has been running the big AIDS program. She's an immunologist. She is first-rate. So I'm very comfortable with who is leading it. The problem is that we have not been giving the resources to all of these agencies or to local governments and to state governments over a sustained period of time. In fact, we put in resources during emergencies, and then we start to cut them when we're not in emergencies. And so our infrastructure constantly has to be rebuilt as we deal with emergencies.
Did you ever deal with anything like this on this sort of scale, potentially, while you were in the Clinton administration for those 8 years?
Yeah, you know, we dealt with SARS, with MERS, with the chicken virus, the hantavirus, and every single time we were totally dependent on states and on local governments on the training in hospitals of doctors and nurses to both identify the disease, and we had to figure out treatments as well as vaccines. But you know, we ought to be anticipating this as opposed to just funding it periodically. And I really cannot criticize this administration when every administration has been lax in continual funding.
You know, it seems as if even in the midst of the coronavirus spreading around the world, the president's budget still had major budget cuts, upwards of 20% budget cuts for the CDC, the NIH. Does that sort of show you a disconnect between how this administration should have been looking forward to this project?
Absolutely, but the Congress is not going to put up with that. Both Democrats and Republicans have made it very clear that we intend to provide supplemental funding, and we never intended to accept those cuts. But what is even more serious is the president is saying something different than his scientists. The one thing we have to do is to speak with one voice, and I think the administration is starting to pull that together. I wouldn't put the president in front of a camera to talk about science, because in his last 2 appearances, he stepped all over the message and actually gave the American people the impression that this was going to somehow miraculously miss the United States, and that was the opposite of what the scientists were saying. We must listen to these scientists, physicians. They're world class. The rest of the world is listening to them. It's very important that political appointees step out of the way. I never spoke about the science. I always put these physician scientists in front of me, made sure that they had a clear message that they all agreed on, put them in their white coats, and let them talk to the American people.
Now, one of the things that you said, you have confidence in the number 2 person that will be directly under the vice president for this. Do you have confidence, though, in the vice president in terms of, although they're not calling him a czar, but in terms of leading this effort and also having all the messaging going through the vice president's office? Are you okay with that?
We'll see whether we're all okay with that. But look, everything's at stake. And Jim, this is a case where I think we should be very careful not to politicize this. We have to be supportive of both the leaders of the country, but in particular of these scientists, physicians that are going to lead us through this. This is not going to end in 6 months. We're in this for the long fun. We will not have a vaccine for 1 to 2 years, which means we're going to have drugs to treat the patients. We need hospital beds. We need diagnosis tests, and we need testing facilities all over the country. So I think this is a time when all Americans ought to pull together.
This also points out one of the issues that we have here in the United States. So many of our drugs, the elements of our drugs, come from China. That now may be disrupted. Will this focus new light and attention on where we manufacture drugs, where the drugs are coming from, the ingredients, and should we be bringing more of that home to the United States?
Not only to the United States, but maybe to other places, so there are multiple sources. But look, the drug companies, the pharmaceutical industry has never been interested in vaccines. You don't make a lot of money out of vaccines, so we have to use a wide variety of enticements to get them into the vaccine business. In this case, we'll be doing the vaccine development pretty much ourselves. The distribution will have to be done by the drug companies themselves. But again, we've got to put the resources in place. We have to make sure we have a national strategy. And more than anything else, from my point of view, we have to make sure that states and local governments are properly funded. The health commissioner, the health department in Miami-Dade has been underfunded for centuries, as far as I can tell. We need to get resources right down to our local sources, and we need to reinforce the resources in our hospitals so that we have the beds and the personnel to take care of patients.
Let me ask you this.
We've done it before.
Let me just sort of ask you to be a media critic for a second. Has the media handled this story well, or have we created more anxiety than should be generated for this? I heard a doctor on one of the TV stations recently say we should be more about being on alert and not being anxious.
Well, it's a delicate balance. You want to tell people the facts. You don't want to lie to them, but you also have to be even-handed to make sure that you're not increasing the anxiety level beyond where it should be at this point in time. That's the importance of the steady hand of these physician scientists, because they're not excitable.
All right, last question I want to ask you, and then I'll let you go. What practical suggestions would you have from the public to protect themselves? You talked about getting the flu shot. What other things? I've heard some people say we shouldn't be shaking hands anymore.
Let me be clear. The flu shot will not prevent coronavirus. What it will do is make sure you don't end up in the hospital or an emergency room in the place of someone that gets sick from coronavirus. Wash your hands. We're going back down to low tech. Wash your hands. And washing hands, keeping surfaces clean, is the only thing that we can do as individuals. If you feel ill, you ought to stay at home and not go to work. But we will have testing devices, and we will have proper guidance out to everyone. And everybody should be looking at the CDC website, but also local public health officials will be issuing warnings and directions. We've got to listen to people that really know what they're doing.
Up next, Broward Sheriff Gregory Tony.